What are some of the things that have been done in the past and maybe some changes that have been improved on? Tell us a little bit about the history of this.
Sure. Let's start with up to the point of where our friends at Pfizer and some of these other pharmaceutical companies have come out with the Viagra and the Cialis.
Yep.
Um, that works to some degree. That's basically works on a pathway of using or accentuating nitric oxide. So that was early on. The challenges there are we're seeing a less and less percent of men responding to that by virtue of severity of the ED, vascular damage, low nitric oxide, and side effects. So in many men, the medicine may work, but headache, nasal congestion, low back pain can happen, so it's not a desirable. So that's been around since about the 80s. And then another medicine came on. This is the less spoken of, but has been a lifesaver for many men where Viagra and Cialis don't work, and that is something called Trimix. It's an injectable medication that has to be used. It's an injection that goes into the side of the penis. That's still around. That's, again, really came to the forefront in about the 80s. There's lots of information out there, but unfortunately, it's not something widely used because dosing is a bit of an art form to getting it right, so you don't end up a patient with a priapism,
Right.
which is an erection that lasts much longer than you want.
Yes.
Which sounds great, and you can brag
Initially.
about it to your friends, but beyond 3 or 4 hours, it starts to be quite uncomfortable. And so that brings us really to some interesting new things on the pharmaceutical front, which we were talking about earlier, which is this science of peptides.
Peptides, yes.
Right, and in particular, let's start with what is a peptide, right? So what we know is proteins are long strings of amino acids of 50 plus. They can get into the thousands, which fold over on themselves and have conformal shapes. Peptides are merely just short chains of amino acids, anywhere from 2 to 50, and there are hundreds of different peptides that work miraculous different functions in the body. And through experimentation and accident, we have stumbled across one in particular that has promise in helping with erectile dysfunction, both in men, but also with libido issues and sexual dysfunction in women also. That one is called, it's bremelanotide, also known as PT141. But this is just, it really works on a different mechanism in the body that has promise in helping men. Maybe when Viagra and Cialis don't work, this might be able to work.